it is called silent killer. One will not have symptoms of hypertension until it strikes you. When we say stroke, they think that it is heart stroke. Whereas the definition of stroke is for brain. With every minute loss, we are losing 1.9 million neurons and we are losing 1 week of our life.
We may have heard of transient ischemic stroke, mini stroke, major stroke, but silent stroke we have to be aware of it. The silent stroke, it is happening without your knowledge.
Bengaluru, one of India's smartest cities, the hub of tech and innovation, is teeming with young professionals. They look fit, are ambitious, and work 12 hours a day. Yet, along the city's dynamic tech corridors lurks a silent killer. As Bengaluru's youth build careers and break barriers, many are also becoming vulnerable to the hidden epidemic of stroke, which is making its presence felt faster and younger than ever before. Today, two of the city's leading neurospecialists from Kauvery Hospital's Electronic City decode the real reasons behind the startling rise in stroke incidents and how quick, informed action is rewriting outcomes. Joining me today is Dr. Sonia Tambe, a consultant neurologist at Kauvery Hospital's Electronic City. Her expertise lies in stroke neurology and neurocritical care. We also have Dr. Ganesh Veerabhadriah, the head of brain and spine surgery, whose advanced microsurgical and neurovascular interventions have saved countless lives across Karnataka. Thank you both for joining me.
Thank you for having us.
A recent study analyzed the data from the Global Burden of Disease Study 2021, highlighting a significant increase in stroke cases from 1990 to 2021, with various risk factors such as stress mostly leading to this rise. Now, the study shows that approximately 12 million new strokes occur each year, and 1 in 4 people above 25 years will have a stroke in their lifetime. Dr. Sonia, let me start with you. What's changed in the last decade that we now see stroke among people in their 30s?
Yeah, so what has changed is that now stroke is not anymore disease of older population. It can happen at any age. As young as 18 years also we have seen stroke happening. Now the most common reason for that is I can divide it as 5S, stress, smoking, sleep disturbance, sedentary lifestyle and syndrome X. I'll explain each one very briefly. So what happens is that now current generation is very stressful and they're under stress tremendously because of jobs insecurity, economic stress, because there is a lot of peer pressure and there is stress at every aspect of their life, from getting up in the morning to travel to sleep. So that what stress does is that it produces a lot of cortisol in your body, and this cortisol leads to increase in blood pressure and it also leads to increase in sugar, and that is how they become chronically under stress and leads to multiple problems. Second is sleep disturbance. Sleep is very important. Sleep is our maintenance system. So if one does not sleep, again our sympathetic system gets activated. When we sleep, what happens is that our blood pressure drops, our heart rate drops, more hormones are produced to metabolize our sugar and our body gets enough rest. Again, when we don't sleep, our blood pressure does not drop, it remains high. Number 3 is sedentary lifestyle. All our jobs are digital. We don't get enough physical exercise. We're not moving around. We are just sitting on one chair. If you sit more than 6 to 8 hours in a day, that is sedentary lifestyle. So this is the third point. Fourth point is smoking. We all know that because of digital exposure and easy availability, young people are now smoking, vaping and using tobacco and even drugs, recreational drugs. So that is the fourth point. And fifth is syndrome X. I'll be talking more about it in coming few minutes. But syndrome X is when people develop high blood sugar, high blood pressure, high cholesterol and central obesity. That is syndrome X. Again, that happens due to stress. So these 5S are very important risk factors for stroke.
Right. Okay. Dr. Ganesh, let me ask you, when you operate on such young patients, what common threads do you see in their lifestyle or clinical background? What are some of the common risk factors observed?
Yeah, that's a very important question all of our public should know. See, what we are seeing in the stroke as of all of us know, bleeding and arterial. So, Hypertension, we are seeing the single most one of the major risk factor we are seeing in all youngsters and elderly. When BP rises, this is leading to even younger generation stroke. And the bleedings, and once it blocks, we are going to discuss further the arterial stroke, what we will see. These are the things we are seeing, and if it increases in the later cases, advanced cases, it requires surgery also. This is what we are seeing. Hypertension is the single most risk factor which is leading to stroke.
Okay.
Yeah, and according to studies, hypertension is something that is highly under-recognized. It is called silent killer. One will not have symptoms of hypertension until it strikes you. That one particular day you will have a stroke or heart attack or kidney failure or loss of vision. So hypertension, what sir mentioned, is very important, that it is under-recognized.
All right. Okay.
And also one more point I want to add, our generation, younger generation, especially IT professional, or whoever, even normal drivers or normal laborers, these people now obsessed with how much walking they are doing. They are counting the steps in the apps and doing. But more than this, what I would like to advise is we have to check the BP more frequently, along with whatever the calorie burn count.
Okay. Okay. We've all heard of the FAST test, right? It's a mnemonic used to identify signs of stroke. But what do you think that despite this awareness, what is the reason behind the delay where a lot of people seek medical help? And do you think then that this denial that makes them, seek out medical help later than necessary is a far greater danger than the stroke itself? This is open to both of you.
Yeah, actually, like all of us know, I would like to give an example. Whenever chest pain comes, people will rush to hospitals, nearest hospital, do the ECG and whatever the angiogram, everything they will rush. But whenever stroke happens, because it's a painless, they will seek the advice of the neighbors, relatives, or sometimes any of the close people. And most of the time, I feel it is getting delayed here. This is the single most this thing, because it's a painless. If your hand is weak or leg is weak, they can sit comfortably. Even sometimes they will talk. I think this is the single most important delay it's happening. Is it not, Dr. Sonia?
Correct. Especially sometimes stroke starts very slowly. They will have slight slurring of speech. They'll be feeling a little weak. They'll not be able to lift their hand, or sometimes they will have a little imbalance. So what they do is, especially if it happens in the evening, they think that, oh, my sugar must have dropped. Oh, I had a long day, stressful day. I have some fever. Let me take rest overnight, and morning I'll go to the hospital. So they will sleep.
Right.
When they wake up in the morning, stroke will be fully established. They will have complete hemiparesis and paralysis, and by that time we would have lost significant important time, that window to give treatment, and that is why the delay happens. And you will be surprised to know that sometimes when we have conducted these workshops in tech IT hubs and sometimes in the schools also, when we say stroke, they think that it is heart stroke.
Right.
Whereas the stroke, the definition of stroke is for brain. Stroke, it is brain stroke. So not many people still know fast mnemonic. So probably more awareness is still required.
Okay. Okay. Actually, can you elaborate what the fast mnemonic is? If people don't know, would you want to just tell them what it is?
So now fast is also called, there is one more, it has been upgraded to be fast, Any sudden onset, B stands for balance problem, sudden onset balance problem. E stands for sudden onset eye problem, like blurring of vision, loss of vision, double vision, all these symptoms. F stands for facial drooping or, facial asymmetry. A stands for arm drooping, they will not be able to lift their hand. Okay, stands for speech problem. Suddenly their speech will become slurred, it will get stuck, or they'll not be able to find the words. And T stands for time. Time is the essence. And time, because with every loss, when the stroke starts, with every minute loss, we are losing 1.9 million neurons, and we are losing 1 week of our life with every minute. So that's why In this year, for 2025 stroke awareness, the tagline is minute matters. Every minute counts. So that is how important the time is. So be fast.
Okay, right. Which brings me to my next question. Some of these things that you said are very evident, visible signs that people can clock in and say, oh, something's happening to me. But what do you say are the lesser known or atypical signs that people tend to miss? So would you want to take that?
Yeah, it is. It's very important to know this atypical signs in stroke. It will be like Madam Sonia Madam mentioned, eye sign, sudden onset of like a blank, sudden onset of blindness. We can tell. Sometimes we may be sitting or watching something. Suddenly it will go blank. Then they will not see anything, and after some time it will become fine. This one of the atypical sign. And next thing is like a silent seizure, fits will tell. So whenever it need not to be jerky movement in the hand, jerky movement in the leg, it may be sudden loss of consciousness or suddenly the vibration of the finger or sudden loss of sensation. These are the two single most atypical signs we have to be aware. Whenever this happens, even though one more thing I would like to mention here, there is something called mini stroke or transient ischemic attack. Whenever be fast, whatever Dr. Sonia told and whatever these atypical signs happens, sometimes whenever weakness happens or speech dysfunction happens, it is likely to disappear without treatment within 24 hours. And people may feel, okay, I become fine, so no need to consult anyone. So this is where we will miss the transient ischemic attack. Whenever this will be happening, always there will be interruption of blood supply to the brain, and again the blood circulation will start. And this phenomena, if not addressed, these transient ischemic attack or mini strokes, it will become major strokes within 1 month or 2 months, and then it will become irreversible.
All right. Let me ask you, do women and left-handed individuals present differently? As in, will any of these signs sort of manifest differently in these individuals?
Yeah, those symptoms, the overall symptoms remain same in women as well, but there are sometimes they have very subtle symptoms like tiredness, a very slight slurring of speech, generalized weakness, and more sleepiness. So these symptoms are more common in women. And when it comes to women, 3 important points we should know. One is when women has delivered, that is postpartum period we call, after the delivery up to 6 weeks, the blood is very thick. So they are very, very prone for stroke at this point. So what happens is that they will be in that postpartum period, they'll be tired, they'll be sleepless. So when they develop this slurring of speech or tiredness, or they are unable to walk, people think that, oh, she's just tired, she has not slept. And they bring the patients to hospital very, very late. And this is very, very common. And recently I had such a case, and that was very unfortunate. Second is women take oral contraceptive pills, to prevent their pregnancy or even to delay the periods. And this oral contraceptive pills has estrogen. Estrogen is something that increases clotting factors in your blood, and that will make them prone for strokes. Third is migraine. Migraine is very, very common in women. Migraine is a condition that causes recurrent headaches. Again, it causes headaches due to changes in blood supply, blood pressure, blood vessels becoming, dilated and constricted. That is how migraine happens. If migraine patients smoke or take oral contraceptive pills, they become very prone for the strokes. And these are 3 points I want to mention. And when you said the left-handed individuals, the distribution of language area is different. Someone who is right-handed, the language area is present on the left side of the brain. And people who are left-handed, the language area is distributed differently. So when they have stroke, they may not develop speech problems. They may develop some other symptoms like disorientation, feeling a little confused where they have to go. And that is how we miss strokes in left-handed individuals.
One more thing I would like to add, pregnancy, postpartum, like Dr. Sonia Tambe Madam mentioned. Now, one myth I would like to debust here. In the general population, once the pregnancy happens, baby is delivered, there is a concept called dehydration. The water we should not give to the pregnant woman for so and so period of time, they will dehydrate. So actually postpartum, we will tell postpartum period is a hypercoagulable state in our medical terminology will tell. Means blood will become thick fast. So in these kind of situations, what happens, we have one main major vessel runs from front to back. That is called superior sagittal sinus will tell, and it can get clotted. And also even in the normal vessels, MCA or basal artery, easily the blood will get clotted and there will be interruption of blood supply to the brain. This has become major concern because it can cause an immediate major stroke, and also it is leading to the death. This has to be actually after pregnancy, pregnant woman should be nourished and adequately hydrated. This would like.
Thank you. That's an important point. Thank you. You walk us through what happens inside a stroke-ready ER. Like, what are the measures taken when a case comes in?
Yeah, like Madam mentioned, FAST, FAST, facial weakness, arm weakness, speech dysfunction. Whenever this happens, patient first will come to emergency department, and patient will be assessed by emergency physician first. See, and time of onset of stroke is very important to note down. And whenever this happens, it will be assessed by ER physician. Next, neurologist will involve, and once neurologist involved, we will start the investigations like a CT scan, brain view. Normally worldwide they will do the CT scan. We'll look in the CT scan whether it's a bleeding stroke or it is a arterial stroke. These two things we will differentiate. Whenever there is a bleeding happens, and we'll treat differently. Whenever arterial stroke, the blood clot in the brain vessel, if it clots, it will treat it differently. Whenever arterial stroke or this thing happens, we'll after the CT scan, we'll do the MRI scan, and whenever it's available, MRI perfusion studies, vessel wall imaging, and everyone thing will do. And once we assess the golden hour, and also we have various scores to assess what is the volume of the brain which is affected and all everything. If everything fits, and also time also, if it is most of the time 4.5 hours or below, as early as possible, we can save more brain neurons. And regarding further thrombolysis and all, thrombectomy and all, we can discuss further. And once we are fit, criteria is fit, we will assess this and we will segregate the patient, and then after that we will shift to ICU, and we will start the medications usually, and then either thrombolysis or thrombectomy will decide that, and we will discuss further. This is what will happen once the patient comes ER, then imaging, and then ICU, and then cath lab or surgery.
So just to add few more points, as sir said, the main, as soon as patient comes, we check their blood pressure, we check their sugar, and we see what time the stroke has happened. So mainly we have to differentiate two types of stroke. So there are two types of stroke. One is either blood vessel bursts inside the brain and then there is bleeding, or blood vessel clots inside the brain and that next part of the brain does not get blood supply and then that dies off. So that is what, bleeding and versus ischemic. As sir already mentioned, bleeding, we just control their blood pressure, we prevent further bleeding inside the brain. Whereas it comes to ischemic stroke, which is 85% of the strokes, it is ischemic stroke. Most common type. So blood vessel has clotted and brain is not getting the blood supply. So what you do, you have to open up that blood supply. How will you do that? You have to either give the injection, which is called clot busting therapy. And this clot busting therapy, there are various different types of injections that are available. Ideally, the patient has to be under less than 4.5 hours to be eligible for this clot busting therapy. And if we give beyond that, it may not work because brain tissue would have already died. Second is, if we also do imaging to see blood supply, the major blood vessels that the brain has. If a bigger blood vessel has clotted, that is when sometimes they require intervention, wherein the patient is shifted to cath lab, a guide wire is passed and the clot is removed mechanically, and that is what mechanical thrombectomy is, and doctor is expert in mechanical thrombectomy. So either we just, if there is a small clot, we give injection to open up that clot bursting, or if it is a bigger clot which will not be busted with this injection, we remove it mechanically, and post that patient will be shifted to ICU for monitoring.
Okay. But come back a little bit to what the surgical team's role is, since you specialize in that. Once imaging confirms a stroke, you can delve a little bit more into it. I think people will be interested to know.
Yes. Like we discussed now, when the two types of stroke, one thing is arterial stroke, next thing is hemorrhagic stroke, like madam mentioned, the burst of the vessel. Let me start with the most common this thing, arterial stroke. 80% of the people will be having presenting with this arterial stroke. Whenever we see either by the CT angiogram or the MR angiogram, the vessel occlusion, there are two things. One is small vessel occlusion, one is big vessel means artery occlusion. Of course, the small vessel stroke, whenever we see, and will not do any surgery, like madam mentioned, will give the thrombolysis drug. And nowadays, so many smart people knows injection. Can you give same thing? The same words they will use in Kannada also. They will, injection kodtira. Same thing they will use, and they will get it done. And whenever there is a major vessel stroke, that big vessel, we will tell as internal carotid artery or middle cerebral artery or MCA or basilar artery. Whenever, most commonly, if these vessels are thrombosed, we'll do counseling. And whenever there is a patient comes in a golden hour, it is 7.2 hours before it was almost golden hour period. Now it is getting extended up to sometimes 24 hours to 48 hours. And this vessel, wherever this vessel is occluded, the part of the brain which will not be getting blood supply, our main goal is to open this vessel. The clot will be sitting there, and we should remove the clot and establish the blood flow to the brain, like a plumber will clean our pipes in our kitchen. In the same way, that's what we will do in the cath lab. We'll shift the patient to cath lab after giving injections and stabilizing this thing, and we'll the surgical aspect briefly, if you ask me to explain. We will make the patient lie down on the cath lab table, and we'll give the small injection in the groin artery, and we'll pass the small hair-like catheters and guide wires, and we'll reach that area where there is a clot is sitting, and we will clear that clot and re-establish the circulation. We'll use the basket like a stent-like device. It will be very small, and we'll catch hold of that clot, and we'll remove that, and the blood circulation will be established. And once it is established, the brain will get the blood supply which was because of that brain vessels block, the neurons will be dying. This will get the oxygen and nutrition. This is very, very important. Then I think once come back, once we establish, and the circulation will shift the patient to ICU, and we'll watch the pressure changes and Glasgow Coma scale, GCS and all, everything in our ICU. This is what mainly required. If this is done in a golden hour, the chance of recovery will be very fast. So many patients come with hand weakness, leg weakness, completely not able to move, and these people we have seen they walk out of the hospital once this procedure is done. And second part, coming to the blood vessel burst or the clot. Whenever these most commonly, once again I would like to stress, the hypertension is the single most risk factor, which is most of the youngsters are getting affected, and youngsters are getting killed because of this hypertensive bleeds. And once the bleeding is seen in the CT scan or MRI, depending upon the size of the clot, we will assess whether the surgery is required or we can manage conservatively. And two types of surgeries we will do here. One thing is the blood clot. If it is big, of course, we'll if it is endangering the life, we'll remove the clot. After doing the small portion of the skull will be removed in the operation theater and will remove the clot. And second thing is, sometimes what happens because of the blood clot, the water channels or CSF pathways will tell it will be blocked. So we'll place a small tube in the brain, and that whatever the blood clots are there, its channels are blocked. That blood clot will be drained to this small pipe. And this blood clot can also happen in the cerebellum. There also we'll do the small cranectomy and remove the blood clot. And also sometimes what happens if a stroke is very big after the surgery, even arterial stroke, we'll do decompressive craniotomy to reduce the pressure inside the brain. These are the advanced procedures. It is also known as mechanical thrombectomy, I will tell. And sometimes what happens, the clot, because of the aging process, advanced aging, along with the clot, the vessel wall will be hard and rock-like calcification will tell. At that time, it may not come with stent retrievers. At that time, we will give the intraarterial thrombolysis will tell. The clots, whenever there is a stuck, it can be melted and blood circulation will be established.
Okay. Sounds a little complex, but now that the crisis has passed, say in this example that you've presented to us, how does recovery begin? Because we're also talking about young people, who will then go back to a life that is filled still with the modern stressors that this day and age, brings to them. So what does recovery entail after surgery?
Yeah, that is very important question again. So whenever the whole idea of stroke treatment is to get them back to their normal life, right? Their speech, their memory, their hand and leg movements, and their coordination has to be normal. So how does that happen? One is treatment. Sometimes patients come late. Sometimes despite the treatment, there will be partial recovery. So we have to get them back to their normal life, right? So younger patients especially, when they have stroke, 3 generations are affected, right? Because they have to take care of their parents, they have to take care of their family, they have to take care of their kids. So young person, the father of a young child gets affected. We want them back to their normal life. So recovery happens in 3 phases. Acute phase, subacute phase, chronic phase. Acute phase starts as early as 24 hours. So within 24 hours to 7 days. Okay, during this time, so when the patient is lying motionless in the bed in ICU and is struggling between life and death, we still want their hand to move. So passive range of movements are done, like the physiotherapist comes to ICU as well, and then they move their hands and their legs so that brain knows that despite the brain tissue has died, the hand leg movements are happening so that the signals are going to brain, and then new neurons connections are forming still. So that is how acute phases treatment physiotherapy begins. So once the patient is out of danger, say that their heart rate is stable, they are no more at risk of death due to the stroke, or their breathing is stabilized, the subacute phase starts. That is between 1 week to 3 months, up to 3 months. And this is a very important window. So when the stroke happens, our body wants to recover. So there will be some natural mechanisms in your brain which want us to recover. So that is, there will be release of growth factors inside the brain. The surrounding neurons, even though there is a dead tissue in the brain, the surrounding neurons, they want to grow. They want to form new connections. They want to send more and more signals, and that is called neuroplasticity. So whenever one brain tissue loses its function, the surrounding brain tissue wants to take up that function. Say if this is called neuroplasticity. During this phase, if rehabilitation is started, patients will get maximum benefit. And that rehabilitation is multifaceted. Right. It's not just hand and leg movement, right? That is physiotherapy. Second is occupation therapy. Occupation therapy is, we want patients to come back to their normal life. We want them to get up, brush their teeth, wear clothes, take bath. These are basic things. That is how, exactly, activities of daily life which we call. That is the first thing that is taught to the patients. And depending on any other deficits that is there, sometimes they will have speech problem, Sometimes they will have swallowing problems, so speech and swallow therapy is given. Sometimes they will have memory problems, they will have recognition problems, so that is when cognitive therapy is given. Sometimes they will have emotional problems, so they will be, not emotionally coherent. Sometimes they will laugh in situations that they are not supposed to laugh, and vice versa. So in such, psychotherapy is given. So it is a teamwork whenever it comes to rehabilitation. Sometimes then comes the chronic phase beyond 3 to 6 months. Even during that time, rehabilitation has to continue because mild stiffness might still be there. So they have to keep exercising.
Okay, so now, but these three phases are common to all.
All of them, more important if they have still deficits left, despite all the treatment. Right? So whenever we are telling this clot bursting therapy, surgery, mechanical thrombectomies, not everyone recovers 100%. It depends on how much their brain compensatory mechanism is there and how early they have come. So if they have come very early, they might improve 100% also. That happens in 30 to 40% of the patients. But remaining 60%, some deficits will still be there. So rehabilitation plays a very, very important role.
Okay. Doctor, what are some of the innovations? Because medical advancements are happening all the time and we keep hearing about them almost every day. But what are some of the innovations that excite you most when it comes to stroke care?
Yeah, that is a very good question. So here I would like to mention something called silent stroke. We may have heard of transient ischemic stroke, mini stroke, major stroke, but silent stroke, we have to be aware of it. The silent stroke is like it is happening without your knowledge. Just if you take even 10 people, we may be talking or we may be drinking, seeing the TV or moving, the stroke will be happening inside. This is called silent stroke. And we have some areas of the brain where there is no localization, like a frontal lobe or deep part of some of the temporal lobe. Small stroke will be keep happening inside, and these, when it happens, we can detect when we are doing the scan for any other reason. It may be CT scan or it may be MRI. It will detect this small stroke. It is also known as silent stroke, and this is linked to the later cognitive decline or Parkinson's disease and all these things. So it is very important to know this silent type of stroke and know the risk factors of the stroke and avoid. And now AI is playing a very important role in detecting this kind of silent stroke. Still it is getting advanced in our current practice. Once this technology comes, AI can detect this kind of silent stroke in advance and give us the alarm that the risk of future stroke. And some of the radiology centers are already in the verge of installing all these apps and AI detected based stroke detection. This is one thing. And second thing is I mentioned mechanical thrombectomy that we are already doing about 10 or 15 years ago. When we were studying medical or medical college or neurosurgery, these mechanical thrombectomy options were not there. It has from last 10 to 15 years, it has advanced and it is revolutionizing the treatment of stroke. And in the future also, what happens, all this AI and then the robotics will, once it take over, the early detection of the stroke and treatment are possible. And whenever the AI or robot comes, always about a few weeks ago, one of the person who is from the newspaper, when we were interviewing, also asked, sir, what the robots, AI, whether it will replace the doctors in the future. I would like to tell one thing. I would like to ask my junior colleagues also, what is the important part of the stethoscope? Somebody used to tell bell of the stethoscope, somebody used to tell the ear of the stethoscope, but the part in between the two ears is the important part of the stethoscope, that is brain. In the future also, whenever AI comes, robot comes, how much your advances another 50 years or 60 years down the line, human brain and clinical judgment is the single most important. It plays a role.
Are you applying AI at this point anywhere? Because you did mention some of use of AI, but are these apps, are these softwares?
Actually, it's a
Correct.
future. In few centers, they are installing and it is getting tried. But ultimately, they are taking this, like I told, judgment of the clinician only the main.
So currently there is no standardization when it comes
Yeah.
to AI, right? We are still learning. So even in acute care or in rehabilitation, both there is definitely role of AI. In fact, there is one AI app which tells us after doing the CT scan, it tells us what is the volume of the stroke, what is the preventive surrounding area in danger, and what could be the severity. So CT guided AI, applications can be implemented in.
But is that accurate? I mean, what's the accuracy?
See, what happens is that it uses a lot of database, right? So it depends on what is the data that has been given. Okay, so it is too premature to talk about accuracy of such things. But yes, if it has been applied and it has been given clearance by stroke associations, then yes, we may depend on that. We may agree with that. Second is AI has some role in rehabilitation as well, especially the what you call virtual reality. So imagine a patient is undergoing rehabilitation in a room with 4 walls. Every day morning he gets up, he does the rehabilitation. Sometimes they'll be in the rehabilitation sometimes. So virtual reality has a lot of role. So they wear these goggles and they can be given the lifelike scenarios, day-to-day scenarios to them. Say they are in bathroom, or they are in their work, or they are in marketplace shopping. So such virtual reality can be given, and then their hand and leg movements can be optimized. Sometimes when they use virtual reality, they can see their own movements as well, and that kind of gives mirror therapy to your brain. So when we see our body in mirror, our mirror neurons get activated, and that is how the virtual reality helps in AI. Third, very important is robotics when it comes to rehabilitation. Though it is not being used very frequently, mainly because of the cost, and then optimization is not very useful. The exoskeleton, that is the frame, the metal frame that fixes according to your hand and leg joints, and based on your thoughts it moves. Okay, so that is what is exoskeleton robotics. So this is something that I am really looking forward to when it comes to future of stroke treatment and rehabilitation. And another point that I would like to add here is stroke ambulances. So dedicated ambulances just to stroke. So the currently ambulances move patients from here to there. What about stroke ambulances which has inbuilt CT scan, inbuilt stroke nurse or stroke doctor? So not only do they save the time, because traveling time in Bangalore is 30-40 minutes, you are losing so much of time. So do the scan in the ambulance. If required, critical care, acute care. If you have ruled out bleeding, and if it is clotting type of stroke, give the injection in the ambulance, then move. So stroke ambulance is something that as an association, healthcare associations and then governance, everything has to come together to bring this into more use.
All right. Yeah. Thank you. It's been a very nice conversation. But just to wrap it up, any final thoughts or any message you would want to give the younger generation of people where their health and especially stroke is concerned?
See, when you are in doubt, seek medical help, right? So do not listen to your friends and family. If you are seeing, because once a stroke establishes irreversibly, there's nothing that doctors can do. It will be a long struggle. So listen to your body. If your body is warning you, please seek medical attention.
Yeah, my single most important message is check your blood pressure more frequently and control your blood pressure. This is very single most cause of morbidity, means the weakness or disability, and also mortality, death after heart attack. Brain stroke is the second most important. cause of mortality and morbidity even in the world and even in the India. So control your blood pressure. This is very important, and the awareness please create, like as soon as chest pain comes, you will go to nearest hospital. In the same way, whenever this fast facial weakness, arm weakness, speech dysfunction, whenever this happens, reach the stroke comprehensive care immediately as soon as possible, so we can save a lot of neurons in the brain.
A stroke can snuff out a person's life in seconds. But better awareness and timely intervention that lead to concerted action can arrest this alarming trend among our young workforce. So make sure to share this video with your friends, family, and loved ones, because stroke stops here. Thank you.